Arterial supply of the face, what you need to understand is that major part of the face is going to be supplied by the external carotid artery. So it's going to be supplied by the external carotid artery. And we are going to talk about external carotid a lot in the head and neck. So all outer aspect of the head and neck is supplied by external carotid artery or the branches of external carotid. Like in the brain, we were talking about either the internal carotid, branches of the internal carotid or vertebral artery. Here we are mainly talking about the branches of external carotid. So for reference, we are going to talk about it later on in detail, but you need to know that there are 8 branches of external carotid. It starts, just above the thyroid cartilage here, and it gives this branch which is called the superior thyroid artery. So the first artery the external carotid is going to give is the superior thyroid artery. The second one is going to run along the pharynx, so it is called the ascending pharyngeal artery. So first is superior thyroid, which is supplying the thyroid gland. Then the second one is going to run along the pharynx, it's called the ascending pharyngeal artery. The third one is called the lingual artery. The fourth, which is going to the tongue, lingual artery is going to go to the tongue. The fourth one is the facial artery. The fifth one is called the superficial temporal artery. And then you have the maxillary artery, the posterior auricular, and the occipital artery. So in total, you have 8 branches. You're starting with superior thyroid. We'll show you in a minute. Superior thyroid, ascending pharyngeal, lingual, facial, posterior auricular, superficial temporal, maxillary, and occipital. So these are the 8 branches of the external carotid. What you are seeing here, the first one which you are seeing here is this superior thyroid. This one is going to be the ascending pharyngeal artery. You cannot see, so this is the lingual artery. The fourth one is the facial artery, which you see, which is going towards the face. Then you have this superficial temporal going up. This is the maxillary artery which goes into the infratemporal fossa. You have the posterior auricular here, which is going to go to the ear, and this is the occipital artery which is going towards the occiput. So these are the 8 branches of the external carotid artery. The major one for the face which you need to remember is the facial artery. So the one which you are seeing here, this artery which runs a tertiary course over the face is called the facial artery. It is going to pass behind the submandibular gland, then between the submandibular gland and the ramus of the mandible, and then it comes in front over the surface of the face. And in the face it is going to give inferior labial artery, superior labial artery, and the lateral nasal artery. So there are 3 branches on the face which it is giving. One is the inferior labial artery which is supplying the lower lip. The other one is the superior labial artery which is supplying the upper lip. And then the lateral nasal artery which is going here, and it's going to anastomose with the branches of the ophthalmic artery, because the ophthalmic artery is going to give the infratrochlear artery here, where the lateral nasal artery is going to anastomose. So what you are seeing is inferior labial, superior labial, and the lateral nasal artery which is going to anastomose with the angular artery from the ophthalmic, and it is going to form an anastomosis here. There is also a transverse facial artery, which is a small artery coming out from the superficial temporal artery, which also comes and supplies the face. So the major arterial supply is the facial artery. It's giving the superior labial, inferior labial, and the angular artery. And there is a small contribution coming out from the transverse facial artery, which is a branch of the superficial temporal artery. Yes? Yeah, so this is the anastomosis which is happening. This is the angular artery. This is the lateral nasal branch of the facial. They are anastomosing on the lateral side of the nose. So this is the anastomosis between the ophthalmic and the facial branches of the facial artery. Venous drainage. is quite complex, so we will not touch at the moment. We would do the venous drainage once we do the parotid gland also, and then we do the complete venous drainage of the face. Okay, so the major part today is to discuss the trigeminal nerve. The trigeminal nerve is a mixed nerve, so it is a sensory nerve and it is a motor nerve, and it is attached to the pons. So you can see from the pons, the upper part of the pons, you have a sensory and motor rootlet of the trigeminal which are going to come out. There are three divisions of the trigeminal arising from the trigeminal ganglion. One is the ophthalmic, which supplies the eye and the forehead. Then the maxillary, which supplies the cheek and the upper teeth. And the mandibular division of trigeminal, which supplies the mandible and the lower teeth. The motor component is with the V3 or the mandibular division of trigeminal, and it supplies the muscles of mastication. Trigeminal also serves as a conduit for the parasympathetic function of the cranial nerve 3, cranial nerve 7 and cranial nerve 9. So all the four parasympathetic ganglion, the ciliary, the pterygopalatine, the submandibular and the aortic, are attached with the branches of trigeminal, and we will see how the parasympathetic supply from the ciliary, from the oculomotor, from the facial and from the glossopharyngeal reach their target organs while passing through the branches of the trigeminal nerve. So let's first look at the cutaneous distribution of the trigeminal nerve, and this we have done it before also. So we are just going to recap the sensory distribution of the trigeminal. So the skin of the face is supplied by the branches of the trigeminal nerve, which is fundamentally a sensory nerve of the head and face, and supplies the sensory innervation to the face and all the way from behind up to the lambdoid suture to the bottom of the chin. So from the lambdoid suture all the way to the chin, it is going to supply the sensory sensation. It does so through its three divisions or branches which spring out from the three divisions of the trigeminal. So this is the lambdoid suture. So this area is supplied by ophthalmic division of trigeminal. So it is the scalp, forehead, upper eyelid, side and the tip of the nose. So this is the side and the tip of the nose, upper eyelid and the forehead of the scalp is supplied by the ophthalmic division of trigeminal. V2 is going to supply, or the cheek, the lower eyelid, nostril, the philtrum, which is the central part of your lip, and the upper lip. And the mandibular division is going to supply the area in front of the ear, skin of the mandible, chin and the lower lip. If we are going to see this, we are basically entire face is supplied by the trigeminal nerve. The cutaneous innervation of the neck is supplied by the cervical plexus from C1 to C4. The back of the neck is supplied by the dorsal primary rami of the upper cervical spinal nerves. So this area is supplied by greater occipital nerve. This area is supplied by the lesser occipital nerve. This area is supplied by the greater auricular nerve. This area is supplied by the transverse cervical nerve. This area is supplied by the supraclavicular nerve. And this area is supplied by the dorsal primary rami of the cervical plexus. Yes.
The greater occipital nerve, dorsal primary radius.
Yes. So these are this is the area, the back of the neck here.
What about the greater occipital?
Greater occipital behind the lambdoid suture. So this is the lambdoid suture. Behind the lambdoid suture, this occipital part is supplied by the greater occipital.
Does it come from dorsal or anterior primary?
No, it is the anterior primary rami. This is the dorsal primary rami, which are only supplying the neck region. Okay, now let's look at the setup of the trigeminal nerve. So, this is the brainstem, this is the midbrain, pons and medulla. You have the trigeminal ganglion in the middle cranial fossa. Just in front of the petrous temporal bone, you have this trigeminal ganglion. This trigeminal ganglion is going to give branches V1, V2, and V3. So you have the ophthalmic division, you have the maxillary division, and you have the mandibular division of the trigeminal. And you have, from this three divisions, the touch fibers are going to go to this principal sensory nucleus in the pons. The fibers for pain and temperature are going to the spinal trigeminal nucleus. The fibers for the motor supply to the muscles of mastication are going to go to the motor nucleus of the trigeminal, which is there in the pons. And the proprioceptive fibers are going to the mesencephalic nucleus, which is present in the midbrain. Now, we also know that the three divisions do one thing in common. Each passes through a bony aperture. So it is going to come out, the V1 is going to come out or terminate through the superior orbital fissure and will be coming over the forehead as the supraorbital and the supratrochlear nerve. So this is the terminal branch of V1. V1 is going to terminate here, coming out from the supraorbital foramen and becoming the supraorbital nerve. So this is the terminal branch of ophthalmic division of trigeminal. Similarly, the terminal branch of the maxillary is going to come out from the infraorbital foramen as the infraorbital nerve. So V2 is going to come out here on the cheek through the infraorbital foramen and will supply the area of the cheek. This is the terminal branch of the maxillary. Supraorbital is the terminal branch of ophthalmic. Infraorbital is the terminal branch of maxillary. And similarly, the mental nerve, which is going to come out from the mental foramen here, is going to be the terminal branch of the mandibular division of trigeminal. There are four set of ganglia, parasympathetic ganglia. So with ophthalmic, you have the ciliary ganglion attached. With the maxillary, you have the pterygopalatine ganglion attached. With the mandibular division, you have the submandibular and the otic ganglion attached. So the ophthalmic division, you have the ciliary ganglion attached. With the maxillary division, you have the pterygopalatine ganglion attached, and with the mandibular division, these two ganglia, these two parasympathetic ganglia, submandibular ganglion and the otic ganglions are attached. Yes.
What's ETN?
What?
Auriculotemporal.
Auriculotemporal nerve. We are going to talk about it. Okay. So, ciliary ganglion is functionally a part of the third cranial nerve. The pterygopalatine ganglion is functionally the part of the facial nerve. The submandibular ganglion is also the functional part of the facial nerve. And the otic ganglion is functionally the part of the ninth cranial nerve or the glossopharyngeal nerve. So we need to see how the fibers or the branches from these other cranial nerves are going to reach these ganglions, and then the branches of the trigeminal are going to take it to the target organs. So the first one which we are going to discuss is the ophthalmic division of trigeminal nerve. An ophthalmic division of trigeminal nerve is a purely sensory nerve. Now what happens that it is going to supply the frontal, sphenoidal, ethmoidal, paranasal air sinuses. So if you have sinusitis of frontal sinusitis, sphenoidal sinusitis or ethmoidal sinusitis, it is usually the branches of the ophthalmic division which are involved, and the pain is through these branches. So if we give you a question where you have a frontal sinusitis and we ask which division of the trigeminal is involved, it's mainly the ophthalmic division of trigeminal. The branches of the ophthalmic division of trigeminal are going to supply general sensation to the nasal cavity, cornea and conjunctiva. So if I touch your cornea and you squeeze your eye, or you have a pain in your eye in the cornea, it's usually because of the ophthalmic division of trigeminal. So cornea, conjunctiva, nasal cavity, is basically supplied by ophthalmic division of trigeminal. Part of the nasal cavity is also supplied by the maxillary division of trigeminal, but most of the interior part of the nasal cavity is supplied by the ophthalmic division of trigeminal. Upper eyelid, the tip of the nose, the central part of the nose, the bridge and the tip of the nose is basically supplied by ophthalmic division, forehead and scalp. Now let's just concentrate on these parts. If we concentrate on these parts and then we see which branches are going to supply which parts so that we can link it up. So we need to keep in mind these sinuses, nasal cavity, cornea and conjunctiva, your upper eyelid, tip of the nose, forehead and scalp. So keep this in your mind when we are going to talk about the branches. And it lodges the ciliary ganglion, which is going to supply the parasympathetic supply of the third cranial nerve. So now this is the trigeminal ganglion here. Can you make out this? This is the trigeminal ganglion. It is giving the ophthalmic nerve, giving the maxillary nerve, and it is also giving the mandibular division of trigeminal. So this is the trigeminal ganglion. You can see this is the optic canal through which the optic nerve and the ophthalmic artery is passing. But this ophthalmic division of trigeminal is going to enter into the orbit through the fissure which is called the superior orbital fissure. So once it is going to come out from the trigeminal ganglion, it is going to pass through the lateral wall of the cavernous sinus, and then it is going to enter into the orbit through the superior orbital fissure. In the superior orbital fissure, it is going to divide into three major branches: frontal, lacrimal and nasociliary. So as it is passing through the superior orbital fissure, it is going to divide into three branches: frontal, lacrimal and nasociliary. So this is the ophthalmic division of trigeminal. It's entering into the superior orbital fissure. It gives the first branch, which is called the frontal nerve. This frontal nerve runs just below the roof of the orbit. So it is lying between the roof of the orbit and the levator palpebral superioris muscle. So it is lying between the roof of the orbit and the levator palpebral superioris muscle, reaches the superior orbital fissure, divides into two branches in the orbit, the supraorbital nerve and the supratrochlear nerve. Supraorbital is going to exit out through the supraorbital fissure, supratrochlear is going to exit out medially, and they are going to supply the upper lid medially, supply the forehead, the frontal ear sinus and also the scalp up to the vertex. So these are the branches of the frontal nerve, the supraorbital and supratrochlear nerve. So you can see this is the levator palpebral superioris. This nerve, the frontal nerve, is running near the roof of the orbit between the levator palpebral superioris and the roof of the orbit, divides into two branches, supratrochlear and supraorbital. Supraorbital is going to exit out through the supraorbital foramen. Supratrochlear is going to supply the medial aspect of the upper eyelid. Both of them are going to supply the forehead and also the scalp up to the vertex. Yes.
What's the function of the levator muscle?
Levator muscle is basically levating the eyelid, but this is not supplied by these nerves. This is supplied, the levator palpebral superioris is supplied by the oculomotor nerve. So we are not going to talk, we are just telling you where the location of the nerve is. It's lying on the top of the levator palpebral superioris and the roof of the orbit, divides into two branches. One is the supraorbital nerve, the other is the supratrochlear nerve, supply the upper eyelid, the forehead and the scalp and also the frontal ear sinus. The second one which you are seeing is the lacrimal nerve. This lacrimal nerve runs on the lateral wall of the orbit. So it is going laterally, running on the lateral wall of the orbit, exit out in the lateral part of the upper eyelid, supply the lateral part of the upper eyelid. It supplies the lacrimal gland also. So it is going to supply the lacrimal gland and it is going to supply the lateral part of the upper eyelid. So you can see it here. It is exiting out here, supplying the lacrimal gland and the lateral part of the upper eyelid and the lateral part of the forehead. Then the important nerve from the ophthalmic division is the third nerve, which is called the nasociliary nerve. Now, nasociliary means that it is going to supply the nose, and it is ciliary branches it is going to give to the